again everyone, this is Dr. Tim Newton with Inspire Movement Physical Therapy. In today's video we're going to talk about a topic that is central and dear to my heart, how to breathe properly, how to inspire. So let's get to it. Now we're going to show you how to breathe properly. The breath is integral and central to everything in the body. So here we go. Let's show you how it's done. With a good breath, we want to focus on the air going into the right part of the thorax. Okay, we want the right muscles doing the job. A lot of us tend to breathe with our chest muscles, and we get neck tension, headaches, things like that. We want to try to get the appropriate muscles doing the job so that we don't have those kinds of muscular imbalances. We talk about that in our neck videos, so check those out if you want to go deeper into that topic. We want the air coming down into the lower rib cage. We want expansion here. We do not want a chest rise, okay? That's where the focus needs to be. Some people have said, think about belly breathing. That is partially right, but if you focus solely on the belly going up and down, forward and backward like that, you are going to engage the sympathetic nervous system and create some muscle tensions that we don't want. It's better instead to focus on these ribs, maybe even as they wrap around the back. Think about expansion there, okay? That's a better way to cue yourself. So we're going to ask our patient here to take a deep breath in, okay? And she's going to go through a couple of breathing cycles, and I'm going to describe what I want her to be thinking about. I want her to imagine, and you to imagine, that you've got a little balloon inside of you, right down here, okay? And there's a tube where the air goes down from your mouth into that balloon. And as you take the breath in, the balloon slowly expands. And as you let the air out, it contracts. It's a good cue to think about where you want the motion going, okay? So as you're going through these breaths, think about that air coming in, going down the tube, and expanding the balloon in here. Another thing that you can do to help yourself isolate the breath to this region, right, using that diaphragm muscle, which runs across here. Another way to focus the effort there is by using your hands to feel what's going on. So we can take this hand and put it on the lower rib cage here, making sure that the elbow is rested on the floor or a tabletop, okay? And then she can take her other hand and put it up here on the chest. Again, making sure that that elbow of both arms is supported. If they're held up, that's going to make you tense up your shoulders and your neck and not localize the breath where it needs to go. All right, so are you relaxed here? Okay. Now, as she continues breathing, she's still thinking about that balloon expansion, expanding down low, but she's also now going to be mindful of feeling this hand doing the expansion rather than this one. Now, I should say, when we breathe in, eventually the chest will rise, and eventually the belly will come up. That's fine, but let that just be secondary. Don't let that be the primary effort. As the breath comes in, primarily you should feel the expansion here first even, and then the other areas start to move a little bit as well, okay? They are accessory to the diaphragmatic expansion and contraction. Okay, so that is the focus. You take a few breaths like this. If you're still having trouble, reducing tension here, maybe try a different position, or you can take advantage of your own breath reflex. All right, so now another way that you can help yourself is to let all of your air out. And by all of the air, I mean all of the air. Blow it all out, 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 out until the lungs are empty, and you're going to hold them empty. Do not breathe in yet. I want you to count to 10. Count to 10 with no air in your lungs. You may even feel a good sense of relaxation as you do this. When you get to 10, you're going to let your body breathe in. Don't actively breathe in. Let the body reflexively draw in that air. As it does that, you're going to feel the expansion down lower. It's a diaphragmatic reflex. That will isolate the muscle activity to the lower rib cage and the diaphragm. All right, and you can go through that a couple of times if you're having trouble. Okay, so these are a couple of different cues on how to breathe properly. Taking advantage of the diaphragmatic reflex after exhaling all of your air and holding a totally exhaled lung. And then you have the hand placement, and then you can also think about the balloon. All right, again, just focusing on the expansion out to the sides of the lower rib cage, not having the chest and the neck be the primary driver. So that's how you do it. That's how you take a good diaphragmatic breath. You do about 5 of these, and you'd be amazed the muscle tension that can be reduced. Sometimes we can even get shoulders looser just by taking 5 good breaths. It's crazy. So I encourage you to make this part of your daily practice. Now you know how to breathe properly. This is where everything starts. If you found this video helpful, leave us your questions and your comments, subscribe, and give us a like. And don't forget to check out our website for more related material at marylandmanualtherapy.com. Thanks, and have an inspired day.